about some cool stuff.
Okay.
We have some good topics today. All right. So this first segment comes from a phone call I got this week in my office, a patient inquiring about a procedure that I didn't really know was a thing. So this is a segment about the vampire breast lift, and spoiler alert, don't waste your money on this, but I am going to like go over all
Injecting blood into your boobs?
Yes, ma'am. I had no idea this was a thing. Yeah, crazy, right? Now,
is it like plasma or something?
It is, exactly right. Yeah, it's PRP, platelet-rich plasma. We actually did a vampire facelift segment, I think, a year or so, didn't we?
I've heard you talk about vampire things.
Yeah, so this is the same thing. So, basically this is injection of platelet-rich plasma, which is gotten from your own blood. So they harvest your blood, they put it in a centrifuge, and when you centrifuge blood, it separates into three components. It's the PRP, platelet-rich plasma, white blood cells and red blood cells. And so the PRP has like all these growth factors and cytokines and all this stuff, which is supposed to, really kind of augment your tissues. And so this PRP injection is kind of a big thing now. And, it started out, I think, first with orthopedic guys injecting joints. And I've talked to some of the orthopedic guys, and they say, yeah, it's helpful. It helps rebuild, if you have like a knee that's been injured chronically, and you inject the PRP in there and people, feel better. I mean, I don't think it's like a miracle cure, but they say that it's, pretty good. Well, then people started thinking, oh, well, I can inject this into my face to make my face better. So the vampire facelift became a thing, which I've never been really impressed with that. And then now there's the vampire breast lift. So the claims of the vampire breast lift: minimally invasive. Okay, sure. It's small needle injection. No downtime. Okay. Improve look, feel, and fullness of the skin and soft tissue in the cleavage area. I don't know about that. And restore of sensation to the nipple areola complex if you've lost sensation. So that's what they're claiming. And of course, the places that are pushing this are like, oh, breast lifts are so painful and they're so dangerous. And, breast lifts like one of the most popular plastic surgeries out there right now. I do tons of them. And also these sites are claiming that this is a lot of the sites that I looked at in the last couple of days when I was researching, they're saying this is FDA approved. Okay, that's false. The equipment for harvesting PRP is FDA approved, but there is no FDA approval for using this for aesthetics.
Okay.
Such as facelift, breast lift. So, it's that slimy, smarmy, aesthetic game of like saying something is, certified or approved, and it's not really, but what they're saying, oh, well, we didn't mean the procedure, we meant the equipment. It's FDA approved, but they don't say that.
Oh.
So the other thing I found too, because I had to learn about this. I mean, I knew exactly what it was when my office asked me about it. I was like, oh yeah, it's going to be PRP. But one of the things I found when I was researching it is a lot of times they will combine the PRP with filler injections. So just like the fillers you get in your face, they're doing fillers with the PRP, which it's kind of cheating, right? Because if I inject fillers into your breast, I mean, you are going to see that.
Yeah.
I mean, there's going to be a difference. Now, granted, it's not a lot. I mean, fillers are expensive, so you're not going to use filler to do a breast augmentation. But I mean, if you inject a little bit of filler in there, it's probably going to be noticeable. And it's kind of a trick, right?
Yeah, because filler works, but you're not really sure. We're not really 100% positive that the PRP works.
Exactly. So I think what they're doing is they're adding a little bit of filler so people see a difference in their breasts, and they're saying, oh, look what the PRP did. Well, not a PRP. So the cost of this, get a load of this, $2,000 to $3,000 per treatment.
You might as well just get a boob job.
I mean, okay, a breast lift nowadays is probably, at least for me where I'm at, I think it's around 7 or 8. All in though, I mean, that's everything. Anesthesia, facility, surgeon fee and everything. But yeah, right. I mean if you're doing multiple treatments, yeah, exactly. Now here's something that's really kind of telling is who is offering this. So I went and I, looked up vampire breast lift, who's offering this. It's not plastic surgeons, that's for sure. I found an internal medicine doctor offering PRP breast lift and an OBGYN, and it's most of these med spa type places. But, I mean, that should tell you something right there. I mean, who in their right mind is going to go to an internal medicine doctor for aesthetics?
Yeah.
I mean, what do they know about aesthetics? Absolutely nothing.
They know how
You
to
know,
treat a cold.
exactly, and so, I mean, that kind of gives you an idea of how serious this is. And further, there's no medical research whatsoever to back this up.
Hmm.
There's research about PRP, but it's mostly,
For
animal
injury
models.
treatment.
Huh?
Isn't it for like mostly injury treatment?
Correct. Yeah. Most
Yeah.
of the data is going to be on injury treatment. So, to my knowledge, there's no aesthetic PRP studies
Yeah.
out there.
I think it's just like something that sounds cool and they're just trying to market it
Of
as
course.
best they can.
Yeah.
And they're like, ooh, it's not plastic surgery, kind of. And it sounds cool.
Yeah. Well, and I mean, and PRP is hot. I mean, people have been talking about it for years, and they're like, oh, now you can get PRP in your breasts. And so,
Yeah, to make it not sound as like plasticky.
right. Or, as invasive
yeah.
as surgery. Yeah,
Yeah.
I get it. And so, all right. So the results. So I went and I looked at a bunch of before and afters, and I swear to God, I could barely tell the difference from the before and the after. The only difference I could tell, and it wasn't any lifting, there were a couple of the patients where I was like, yeah, maybe the after is slightly larger, but that's not the PRP. I mean, the PRP doesn't have enough volume to cause any type of augmentation whatsoever. So I would reasonably assume that the patients that they look slightly larger, that they probably got some filler, which I don't think putting filler in the breast is a good idea. It's kind of a dumb
How long
idea.
does that last?
A year,
Ooh,
right? Yeah. I mean, so it's like, why'd
definitely.
you do
Why
that?
would you just?
But I'm going to
not
let
do
you guys be the judge. I actually pulled some befores and afters off various pages of these vampire breast lifts. Okay. Vampire breast lift number 1. What do you guys think?
it? It's like a slight difference.
And how?
They just don't. It looks a little bit more perkier.
You do think it looks burger?
Yeah.
I think it looks slightly bigger. I mean, there's still like
I don't think it looks very much bigger. I think it just looks a little perkier.
You think so?
Yeah.
Okay, well, I mean,
The only reason I can tell is like on the inside part, like on the before, it's like a little bit flatter, and then on the right side, it's a little bit fuller. Like on the inside cleavage.
I don't
Not
know.
on the. I'm not looking very much on the side boob. I guess the side boob kind of looks a little.
I
bit
mean,
bigger.
to
I don't
to
know.
me, the shape and the fall of them is the same. I mean, to me. Now, I'm
I
not.
think the shape is still there. I just think they look like a little bit more inflamed.
They
know
look a
what I'm
little
saying?
fuller to me, and
Yeah.
and I will say, it would be interesting to know when they took this picture. If they took it right after they injected or the day after, they're going to be swollen. You can't stick your tissues without getting a little
I
bit
think it was a different day because that lighting is completely
slightly different.
Yeah.
Yeah, I don't know. I don't see $2,000 to $3,000 worth of difference
Their
there.
skin color looks different too. No, I wouldn't pay $3,000 for that.
No, I wouldn't.
I would just go like, you can't you get kind of a little bit of a lift if you do some exercise?
No, not really. Not for your breasts. that would be nice.
Just a little
I mean,
bit.
to me, it looks slightly bigger. And again, the PRP is not going to make them bigger. That's going to be they probably injected filler because
Well,
I think
the thing is that this lady is gonna have to go like a year or so after. She's gonna have to go do this again if she wants
right, yeah.
that same result.
Well, and if you add,
and by that time, it's like you might as well just get
yeah.
a
And if
boob
you
job.
add filler to it, those prices I quote were just for the PRP. That's not for filler's expensive. Adding filler is, that's going to add another $1,000, $2,000 to it easily. All right, let's see the next one.
Yeah, you can see a difference. Looks like she lost weight though too.
I mean, to me, it looks smaller.
Yeah, it's not as they're not as saggy, but it looks like she lost weight,
It does look like she lost weight a little bit.
and so she would lose fat from her boobs.
They look deflated to me.
Well, they look deflated at the beginning though too.
I mean, they look more deflated to me after.
Oh,
I just like I would never post this as a before and after as a way to try to convince somebody to do something.
no, I think she lost weight,
Yeah, right.
and that I don't.
I do think she lost weight. If you look at the shadowing on her lower abdomen,
Yeah,
you can see that
Yeah,
that she has lost weight,
yeah.
which
And
really
the side boob fat situation is not the same.
Yeah, it looks like she lost a bunch of weight. I mean, so that's like you can't. I mean, I don't know what they're trying to show there. I don't see it. All right, let's see the last one.
Or the comment should be, "What's this for?"
I mean, that one to me almost looks like the same picture. I know it's not because
I agree.
It looks like an after, like immediately after. The only part that looks different is the like not even the boob part. It's like the top part looks
Yeah.
like red and inflamed.
it does. I agree. It looks like they did that maybe the day after.
Yeah, it looks like it's all like on her actual chest,
Yeah, it doesn't.
not her breast.
I bet that one had to be a day after photo because you're right. It looks like it's a little bit inflamed, and so they probably do these pictures pretty soon after when the breast is still a little bit swollen.
Yeah, I see the same blanket at the bottom of it, the bottom right.
Yeah. Yeah, it has the same blue.
Maybe it was the
surgical
same day.
blanket. Yeah.
It could have been the same day.
Yeah, it could have just been an immediate before and after.
Yeah, I don't know. I just, I mean, I'll give anything the benefit of the doubt, but I mean,
I don't think this procedure is worth $3,000, and I don't think it's worth me showing my boobs to somebody. That's what I don't think. Like, you know, like if this girl is like, yeah, here's $3,000. Also, take a picture of my boobs
yeah.
and put it on your website. I would never. If you're gonna put my boobs on a website, they better look good. You know.
Oh my gosh, Sarah.
I don't.
I agree with you. I just don't see it. You know, for me, I think this is kind of a scam. You know, it's using technology that's out there that has some data to show that the technology is helpful in one application, and you're applying it to something totally different and trying to convince people that they should do this. So, and another thing too, I mean, there's no plastic surgeons, I think, that are offering this. I mean, the people who know aesthetics, and we offer a lot of non-surgical treatments. We do. I mean, I'm more than happy for someone to get the result that they want non-surgically. You know, if that can be done, but I just don't see it with this. And you know, it's not FDA approved. You know, the people that are offering it are not experts in aesthetics at all. I think that I think people should steer far. I don't think it's dangerous. That's the only positive thing I can say about it.
Yeah.
You know,
That's just not very effective.
yeah, it's just not effective. I don't think it's dangerous. I mean, like some of the other things we're going to talk about later in today's show, but on the other hand, I just don't see. I look at the befores and afters, and you know, maybe they're slightly larger, but that could be either filler or they just took the picture right after they injected them, like we thought on the last one.
Yeah.
But I mean, yeah, I recommend people steer away from this one.
Me too.
I just think that it's a waste of money. Yeah. So today we were talking about the vampire breast lift. I didn't know this was a thing, but somebody called my office asking about it, so I had to look it up. I knew what it was going to be. It's platelet-rich plasma injections in your breast, and PRP is a thing, mostly used for joints to improve the overall health of maybe a chronically damaged joint where there is some data to show that it's effective. And of course, some people have jumped on that technology to say that it's great for doing a non-surgical facelift, which I don't really believe that works, and now a breast lift. And the only positive thing I can say about the vampire breast lift is that it's probably not harmful to you. But today we looked at some befores and afters in our segment, and we just really did not see much of a difference. And this procedure will cost you $2,000 to $3,000 per session. And this is not an FDA-approved treatment. And when you look and see who's offering this, the doctors I found were internal medicine doctors, OBGYNs, people who really don't know anything about aesthetics. So, yeah, I think that the vampire breast lift is kind of a scam, and I would advise you not to waste your money. So there you go.